Hello and welcome. My name is Hannah Tyndall, and this is my virtual capstone TED Talk. A little bit about myself. I'm a senior nursing student at Viterbo University in my capstone course. For my capstone course, I was at the NICU in Rochester, Minnesota. I really enjoyed this placement because NICU is part of my passions. What started this passion is that I had a family member, my nephew, who was in the NICU for 105 days the first time. Through this experience, it made me realize how much these nurses cared about their patients and really were important to their patients, because our NICU babies don't have the ability to verbalize when they're in pain or when they're hungry or when they need comfort. You have to really assess the patient to really find out all of these things. Throughout my capstone experience, I was hoping to learn how our neonatal patients really communicated those needs with us. I believe that I successfully learned this and felt very comfortable by the end of my capstone experience assessing a neonate. Some things I wanted to learn as my goals, were having more exposure to my IV medications, which most of our neonates are on IV medications because they can't take things orally, or they're on medications through their G-tubes, and improve my assessment skills, which NICU is all about assessments because, like I said, they can't tell us what they need and when they need it. And they can't tell us if they're in pain. So it's really every 4 hours or more sticking to that assessment, making sure you're uncovering the whole child and looking head to toe, every crevice and crease. And then I really just wanted to enhance my critical thinking skills. And this last goal, I believe I really excelled in, because we may have one lab result and we have to figure out, okay, now how do we exchange their ventilator? How do we figure out how to do that? We work side by side with RT and the residents just to really hone in on the settings or the patient itself. NICU is very patient specific. My fourth goal I really wanted to look at was just the overall NICU daily roles and just NICU flow of things. I believe I really got a good experience on this because I had many different patients, from critical to our growers and feeders who are just there to eat and grow and just not so much need that all around care. So when we had our intensive patients, we were really reliant on people around us. We not always could leave our rooms or just go out and grab something because a lot of those patients are one-to-ones. So we rely on our coworkers to stop in, see if we need anything, to peek our heads out and see if anybody's in the hallway to help us. But then with our growers and feeders, we're the ones that, okay, I'm not doing anything, my charting's done. What can I go do to help someone else that may have a critical patient? Do they need a break for 15 minutes? Do they need to use the bathroom? Do they need a medication or a supply or something like that? So you really have to rely on other people to help you. I just really think that before I went into this capstone, I was really nervous, to be expected. I was not sure if I had the skills of nursing due to COVID being out of practice for 8 months to really be ready to go out into the professional practice myself. But after this capstone, I really feel like I am ready to have a patient and care for them and find my passion within nursing and really just go out on my own, have my critical thinking, my advocacy skills, just all around. This capstone really prepared me for my nursing career. Other things before my capstone I was worried about were things like time management or interprofessional communication. These are two huge things that I learned during my capstone because our babies are on a pretty strict schedule. You have feedings every 3 hours, assessments every 4 hours, or sometimes every 2 hours. Plus then you have all your charting, and then you have parents there asking you questions, plus you're trying to help others. But throughout this capstone, my preceptor really just helped me to realize that, okay, set your goal in the morning, set your time, see what you have all to do, and then just really be able to kind of block it out during the day. Sometimes things don't always work out as they should be. Sometimes your assessment gets pushed forward, pushed back. You just have to kind of be flexible with that. And then with the interprofessional communication, I was always kind of worried. Doctor comes in, they're kind of, okay, this is the plan for the day, this is the rush, okay, bye. But there's a huge thing of being like, okay, slow down, tell me the plan for the day, then recap, make sure everybody understands, make sure the nurses have time to put in their input, and to say, no, maybe that was true yesterday for this patient, but today, maybe we're desatting way more and they didn't realize that. Or maybe they're not telling their feeds and they didn't realize that. So then we kind of have to reset the plan for the day and just kind of start all over. I do truly think that my capstone placement at the NICU Rochester prepared me for my professional nursing experience. Thank you for attending my TED Talk.